Welcome everybody to my new video where today I'm going to be changing things up a little bit and I'm going to be giving some patient advice, particularly to people just starting out on their medical journey with HLRCC. Much of this information is going to be based on my own personal experience and what I found to be most helpful in getting doctors on board with taking this condition seriously. It's no secret that most doctors, even very good ones, have never heard of HLRCC, and so it can be an uphill battle in convincing them to order the proper tests and imaging and taking our symptoms and complaints seriously. By far what I found helps the most is going into doctor's appointments with data in hand. And really, this is true for any doctor's appointment, not just with HLRCC. And the first thing you will want to do is compile as much family medical history as possible, and to paint a big picture that lets the medical professionals know the scope of the issue. All this information can be organized in what is known as a family pedigree chart, which we see here. And what this chart shows is how the genetic disease has passed through the generations and the resulting health consequences it has caused. Along with coming prepared to an appointment, the act of handing over a homemade, professionally looking medical document is a very good nonverbal way of communicating with a new doctor that you are a serious, well-educated patient who has done their due diligence, and not just some hypochondriac who went on Dr. Google and thinks everything causes cancer. In addition to that, this pedigree chart can clearly show a pattern of health issues related to HLRCC in multiple family members, and I have no doubt that doctors will be more receptive in getting the ball rolling ASAP when they see how big of a problem this is. Also, when you do finally see a genetic counselor to get your genetic test for the FH mutation, they will have a lengthy interview process where they will ask you about your family medical history, and they will make their own pedigree chart for you. Now, doing all this ahead of time will make the process much easier, especially if you don't know a lot of this information off the top of your head. But before I show you how to make your own pedigree chart, I want to show you how to use Ancestry.com to find the information on past relatives. If you are anything like me and my family, we knew next to nothing about our extended relatives' health history, but thankfully Ancestry makes it very easy to look up old death certificates, which can give you a lot of insight into possible connections with HLRCC in your family's past. So let's take a look at Ancestry.com and I'll show you how to create your own free profile. So first you'll look here, it says free trial, you want to click on that. And you'll see normally it costs $25 a month. They have these extras which can give you a little bit more information, but totally not necessary for what we're doing. So let's start our free trial. So first you have to fill out some basic information. You want to use a verified email address. Once you create the information, they're going to ask you for a payment and the address. And so even though it's a free trial, this is like the standard situation where you get, I think, the first month free or the first 7 days free. I forget what it is. And then they'll start charging you if you don't cancel on time. So the really nice way of getting around that is if you have a gift card, like a Visa gift card, and it's expired, it's already used up, you can still use the information, the numbers on this to get a free trial. So after you plug in all the information and you press start free trial, when I first did this, it said that there was a problem and I had to try again. But all I did was click start free trial again and it worked for me. So just give it a couple chances and see if it works. In this case, it's probably not going to work because I just used this information on the card. But if you don't have this, you can still use a regular credit card and just remind yourself to cancel it before they start to charge you. So once you log into Ancestry, you'll start with your name and then you'll put your parents' name and whatever family relatives that you know, you can input that data yourself. And that helps whatever software algorithm Ancestry uses to find connections with what other people's family trees say that are related to you, or just possible hits within the database that they find. And so what you can see here is I have my name, and then I'm using all made up relatives names just because I didn't get the permission to put it in here. So you can see Abby is my mom, and then Joe and Angie are her parents. And what you'll notice is when you let Ancestry run for a couple minutes, they're going to kind of scour their databases and see if they find any connections. And when you see this green little flag in the corner, it lets you know that they found a hit. And there's hints that let you know that I think we found somebody related to. And so you would click on this green little leaf and it shows you possible connections that you might not know of. So in this case, if we clicked on Joe's icon here, it would show us 11 hints and 11 documents related to his life. In this case, if you scroll down, you'll see things like he was in World War II draft card. But if you're lucky, you'll find a death certificate. And when you click on that, it'll give you information related to what caused his death. Maybe it's HLRCC related, maybe not. And so that's the information we can use to kind of piece things together. So what I'm going to do is I'm going to upload this PowerPoint or these slides to my Google Drive, and it's going to allow you to download them and use this as a template to create your own. And you really don't even need that much to get started. You'll notice that every square is referring to a male, every circle is a female, and then if the person's deceased, you can put an X inside the box, or sometimes they'll put a slash in it. These are just vertical and horizontal lines that you're going to allow to connect the dots. And then if they have HLRCC or suspected HLRCC, because you can't really know for sure, especially if they're dead, I'm going to shade those boxes in red. So this is how I went about creating my pedigree chart. I was able to start many generations back. Here we can see with John and Matilda, and I don't know which one of these had HLRCC. I'll never know. So I put a question mark there. And when I looked through all the data, I was able to see that they had 5 children, but I was only able to find the health history of 2 of them. In this case, Mary and Betty. And I put their ages underneath their name, just so as I'm following along, I can see, did they die suspiciously early or did they live to a good old age? Both Mary and Betty married somebody, so we're going to put a square for them. And since they're not blood related to the family, their data isn't going to be relevant to this, so I'm not going to bother putting their name or kind of confusing the entire chart with unnecessary data. So I'll just leave them blank. So then we'll start on this left side of the screen with Mary's family. And we'll see that she had 3 children, 1 daughter and 2 sons. In this case, when I looked it up, Joe is my grandfather. But William Jr., we didn't even know he existed within the family until I went on Ancestry.com. And we can see that he died at 38. So now you should be thinking, okay, that is an early death. Maybe this is somehow related. And then we can see both Joe and William Jr. got married. And to finish out this generation, we can see on the other side, Betty had 2 sons, Thomas and Fred, and both of them also died in their mid and late 30s. So again, something we can look more into and hopefully find some kind of death certificate to see what was going on there. And Thomas and Fred also married. We'll continue down to the next generation with my grandfather, who had 3 daughters, Michelle, Heather, and Abby, and all of them got married. And same thing over here, Fred ended up having 2 kids, Debbie and Harold, and you'll see Debbie died at the age of 12. So another mark of suspicion. And we'll finish out with the newest generation, which I'm part of. My Aunt Heather has 2 kids, a son and a daughter. And then my family, we have 4 children, 3 boys and 1 girl. And now that we've laid out all of the connections, we can start kind of filling in the gaps of where HLRCC fits into the picture. So the way my family figured it out is my brother Banjo went to the dermatologist and he had the leiomyomas on his back biopsied and they came back positive. So he was the first one to be officially diagnosed with HLRCC. Once we learned what HLRCC was and what a leiomyoma was, my mom was able to kind of connect the dots and realize that her dad, Joe, had terrible rashes on his abdomen all his adult life and they caused severe pain. And when he was alive, they called this kind of chronic shingles. But now we know this was just a really bad case of leiomyomas. So we can shade him as red. And he deceased, in his 70s of an aortic aneurysm. So probably not kidney related, but he definitely had really bad leiomyomas. So after my brother came back positive for leiomyomas, I went to get a couple bumps on my left shoulder checked out. And sure enough, they came back positive. So now I'm shaded in. And so since I'm positive, my brother's positive, and my grandpa was very much likely positive, we automatically know my mom is positive. So we're shading here. She doesn't even need to get any skin biopsies. It has to be that she's positive. But we can also look at her medical history and we can say she had large fibroids, hysterectomy, and skin bumps, all at an early age. And then when we asked her sisters, we could see that they also had hysterectomies at early ages. And when I asked my cousin, she had a hysterectomy at the age of 27. And as I was saying, I don't officially know that they have HLRCC, but the whole point of this document is to catch my doctor's attention and let him know the extent of this problem and why it's so serious. And so I don't really care about the accuracy so much because it's not important for anyone else but me and what my doctor's opinion is. And so I'm going to paint the picture as vividly and as seriously as I can. And if I'm potentially wrong and maybe they had a hysterectomy for some other reason, okay. But the goal is for me to get that screening and to get the doctor to know that this is a real issue. So then to look more closely into William Jr.'s circumstances around him dying in his late 30s, luckily Ancestry.com was able to show me a death certificate And when you bring this up, I kind of redacted all any important information. But you can see here, he died at the age of 38. And usually they put the cause of the death. In this case, they said malignant hypertension and uremia, or blood in the urine. And they related this to advanced nephrosclerosis. And now, anytime I see something kidney related on a death certificate, I'm going to chalk it up to HLRCC. I don't know for sure, but that's what I'm going to go with. And it seems like a likely connection. And you also have to remember, this was in the early to late 60s, and the extent of the autopsy, who really knows how much they looked into it. But kidney related, I'm going to go with HLRCC. We'll then jump over to this other side of the family, which I put down here as cause of death. So again, both of these died in their late 30s. And again, you were able to find a death certificate for Thomas here. Again, you can see he died at the age of 35. In this case, he had a heart attack or a myocardial infarction, but it was due to congenital polycystic disease of the kidneys. So cyst on the kidneys, I'm going to chalk it down as possible HLRCC. Same thing with his brother, Fred. We can see he also had uremia and polycystic disease of the kidneys. So I shade him in red with an X. And then Debbie, I wasn't able to find a death certificate, but my aunt was able to remember that she had very bad kidney issues as a young child, and what officially led to her death we're not sure of, but kidney related, so I'm marking that down. It's really possible that this side of the family suffered a completely unrelated kidney issue, particularly it could have been PKD or polycystic kidney disease. It's possible that their dad over here might have had a genetic deformity that caused kidney issues, or maybe HLRCC mixed with another kidney issue could have made things extra worse, and that's what happened with Debbie here, maybe two HLRCC parents. Hard to say. Again, the death certificates don't get into the specifics and how they differentiate polycystic kidney disease compared to a lot of cysts in kidney cancer. It's impossible to say. But that being said, having two deaths in the mid-30s and I'm in my mid-30s, this is definitely going to get the doctor's attention, and that's what I'm striving to do. So then here we can see both sides of the family had possible HLRCC. That means we're going to likely assume that Mary and Betty also had HLRCC. There's still no way of knowing which of their parents possibly had it, but that's really not important for the overall picture. And now that we have the whole pedigree filled out, I was able to make a summary of every potentially HLRCC positive person and their relevant symptoms, their age of death, and the possible cause of death. And I printed this out and I was able to give it to every doctor I went to. And not only were they just impressed, because they don't usually see this kind of information, you could tell that they took me more seriously. And because of this, I was diagnosed in May. I was able to get into a CT scan oncologist appointment within that month. My CT scan came back. I went to the NIH, showing them my results. I have a complex cyst on my left kidney that we're closely watching. So from May to October, I already went to the NIH and got 2 MRIs. Hopefully then when you complete this, everything makes sense and there's nothing more to really have to explain, but there are going to be certain scenarios that make you kind of scratch your head and question what's really going on here. So let's take a look at some of those possible issues. So these are some things you want to keep in mind. First one being the possibility of a de novo mutation. So here you can see I had my leiomyomas, I got tested for the FH gene, so I'm here in red, positive. But when I look at the rest of my family tree, there's no other signs, or I talk to my relatives, and nothing really points to HLRCC being in anyone else in my family. Usually with HLRCC, germline mutations exist in every sperm and every egg cell, but with a de novo mutation, just one of those sperms or one of those egg cells randomly gets a mutation after it's been made, and then that's the one that just so happens to cause the fertilization event, and so then the offspring has the resulting mutation in their entire body. But because your parents only had that one egg or sperm with mutation, all the other ones were normal, they're not going to pass it on to anyone else in the family, and no one else in the family is going to have that mutation. And so this is just a one-off chance that happened at the moment the sperm and egg that created you came together. In this case, though, you'd still want your parents and your siblings to get tested for the FH mutation to definitely rule out that this isn't a germline mutation, and it is in fact a de novo mutation that exists within you. Another possible situation that could come up is that when you're looking at your family tree, you can see evidence that you have HLRCC, your grandparents definitely had HLRCC, it's all over the family. But the generation between, when you ask them what their symptoms are or anything that kind of resembles HLRCC, nothing really shows up or is indicative that they contain this disorder. However, you have to remember, as I said in my last video, the penetrance of HLRCC is not 100%. So in a certain subset of the patient population, some people aren't going to have any leiomyomas, fibroids, or renal cell carcinoma. They just don't have any phenotypic expression of that disease or obvious symptoms of it. However, if this is the case, they still carry that FH mutation. So if they were to get the genetic test as they should, they would still be positive. In this case, if I have a positive FH mutation, my grandparents are most likely to have it. My mother, Abby, has to have the FH mutation, and when she would get tested, we would see that that would be the case. And lastly, aside from all the benefits of giving this to your doctor and letting them kind of get the big picture view, you can also use all this information in your family tree to know who to reach out to and let them know that this genetic disorder exists within your family and that they should go and get tested to see if they have this mutation or not. In my case, I've never met this entire side of the family, but we have their names, and so with the help of Google, it'll be easy enough to find their phone numbers, email addresses, or addresses, and make contact with them and give them the necessary information to let them know they should be tested. All that being said, that does not mean they will take you seriously enough and feel the need to get tested. So when you do reach out to them, really stress the importance of this potential genetic disorder and how important it is for themselves and their other family members to get ahead of the game before it's too late. And when you do reach out to your family members, make sure that you tell them it's the fumarate hydratase mutation. If you just say the FH mutation and then they go and Google FH mutation, you will get results for familial hypercholesteremia, which is just high cholesterol, which is a much less serious genetic mutation. But because it's more common, it's going to show up on your Google results more likely. So use the whole term fumarate hydratase. Also use that term with doctors, because if you say FH mutation, that's what their mind might go to. But also use the term HLRCC, because when you type that in, you'll definitely get the results that you need to get. All this information too should be covered when you see your genetic counselor. The genetic counselor is going to be one of the first people you make contact with. Generally, you might go to the dermatologist or a gynecologist first. They'll do a biopsy, suspect that you have HLRCC, and they'll refer you to a genetic counselor where they'll either draw your blood or get a saliva sample, and they'll send it off to a genetic testing company where they'll look for that mutation. In my case, they sent my samples to Invitae, and what's nice about Invitae is the first person in the family to get the test has to pay the money for the test. But if it shows up positive, all other family members can get tested for free because they know exactly what mutation they're going to look for. And so that makes it easier to test everyone else in the family, and they don't charge anything for that. But while we're on the subject of genetic testing, in my particular case, when I went to the genetic counselor, they give you like a whole chart of cancer-associated genes that they can test for, and it doesn't change the price of the test. If they look for one, it was $250. If they look for all 20, it's still $250. And so they give you the option to go through and see if you want to look for any other mutations as well. So if you have a history of breast cancer in the family, they could look for the BRCA gene. Prostate cancer, they can look for other genes. And so you can pick and choose. It's up to you what you want to do. Your genetic counselor can kind of advise you along with that. The only situation that I wasn't made aware of when I did this, there was a test for a pheochromocytoma, and I know that goes along with HLRCC, and because I have POTS, I have kind of symptoms associated with pheochromocytomas, so I was interested to see maybe I have a genetic mutation for one. So I chose them to test for that. But when I got my bill back from the testing company, because the pheochromocytoma one was an experimental genetic test, my insurance company denied coverage of all the other tests together. So even though it didn't cost me more to get that experimental one, my insurance company used that little caveat to rule out paying for it. So I ended up paying the $250 out of pocket, which I don't consider terribly expensive, but for some people that is. So keep that in mind. Consider asking your genetic counselor if any of these are experimental, or reach out to your insurance company and see if there's any fine print that you want to be aware of or careful of. I was also told too that sometimes the insurance can charge even more than the out-of-pocket $250. And so you'll kind of see which is the best way to go in that case when you get to that point. Before I forget, there's also a second kind of ancestry type of website that I was able to find good information on. This actually is called FamilySearch.org. This is part of the Mormon Church. They're very particular in keeping very good record keeping of genealogy. And so you'll most likely find a couple hits for your family in here. I should say in America, and I can only kind of vouch for an American and European connection between Ancestry.com. I'm not sure how much it ties together with other countries, but it's definitely worth trying to check out and see. And then finally, as I said, I'm going to put this up on my Google Drive. And so I'm going to have a link I'm going to share in the description. And what you can do is when you open up this link, it's going to be view only, so you can't change anything. So what you'll have to do, you'll go download, and you'll download it as a PowerPoint. And once downloaded, you can open it up, you'll enable editing, and you can use these to build your own. So what I would recommend is you write this down on loose leaf. You just kind of draw out your pedigree chart. And if you don't know how to use PowerPoint or Google Slides, but you still want to make one of these, you can always reach out to me and you can just give me a copy of your pedigree chart that you hand drew, and I could probably make you one fairly quickly. I can't help you look stuff up on Ancestry, that'd be too much, but I can definitely put this together without an issue. So I hope you found this helpful and you can utilize this in creating your own pedigree chart. Again, reach out if you have any questions or you need any assistance, and I look forward to seeing you with my next video.